What does the chapter do specifically? There's three main things. First are the campaigns. And the campaigns, there's three different types of campaigns. There's individual giving, there's small business, and then there's staple events, so like 5K. And we work year round to use these campaigns to raise money for implementing our project for that particular year. Global Health U was implemented because the national office really recognized that we have a lot of energy and a lot of passion for global health, and that with a stronger education and a training program, it would enable students to better harness our energy and be more productive. So every meeting we're going to have a brief discussion, a brief topic, and throughout the year these will include gender and global health, the politics of global health, community-based approaches to health, and the environment and global health. Last but not least, there's going to be a GROW trip, which stands for Grassroots On-Site Work. A few of us will be able to go to Uganda, hopefully next summer, and actually work on the ground with our partner organization. And that leads us to who our partner is. Africa 2000 Network Uganda, they really like being called A2N. They think it's pretty clever. But they're located in communities across Uganda, in a number of them. We're going to be probably working in one of those areas. They were formed in 1990 by a United Nations Development Program, but became an independent NGO in Uganda in 2001. And their purpose is to alleviate poverty by supporting smallholder farmer groups consisting of rural men and women to undertake initiatives geared towards livelihood improvement and natural resources regeneration and conservation. So they have a lot of current work that's going on within them. They're working on a farmer to market initiative, so they're trying to get farmers to bring their crops to market, to sell them, to gain a disposable income, and therefore that will improve their health and get them out of poverty. Poverty eradication, they specifically focus the most poor in the certain communities. They give them crops that will gain more money. They educate them about HIV/AIDS, and they actually try and improve gender relations within them, because oftentimes the men refuse to have their women working out in the fields with them, and with an extra set of hands that can really help out. They also have a Striga control initiative. Striga is a weed that actually just wipes out crops in Uganda. And so they're trying to develop crops that will be resistant to them. They have a prevention of mother-to-child transmission, so they focus a lot of their poverty eradication efforts on families that have been affected by AIDS. Food security, they're trying to build sustainable practices so that people don't become malnourished when there's crop failures. And a local level integrated information systems project, which I'll talk about a little bit later. So our partner really approaches improving health inequity through both sides, but they're primarily focused on development. They also try and improve race-gender relations. They talk about health prevention through health education. The potential project that we'd implement for this year, there'll be others in other years, but we'd be funding a resource center as part of the local level integrated information systems project. And this resource center serves a variety of functions. It's kind of a tool for communities, for farmers and communities to go to find out information about agriculture, to record information about agriculture, to discover what the Millennium Development Goals are, and then to work and improve these Millennium Development Goals kind of sustainably, organically, by recording them and reporting them. But it seems like a really cool project. So ways to get involved. How could you get involved? You could either become a staff member or just attend our events, but as a staff member, you would plan and execute campaign fundraisers to support projects at A2N. You'd also contribute to discussion on global health issues as part of Global Health University. You plan public education events, have an opportunity to go on the GROW trip to Uganda, and you'd attend a network-wide global health summit in the spring. I was actually fortunate enough to go to a Leadership Institute conference in 3 weeks ago now, and it was a really fantastic experience to meet a lot of cool people. And this Global Health Summit is even longer, and it's even better in the spring. And then if you don't want to become a staff member, you can attend our events, support our cause, spread the word. We really appreciate that too. So the GlobeMed structure, there's a lot of options in what you can do if you become a staff member. You can either be on the executive board, and we have a number of different positions on the executive board. There's a director of community building, director of finances, director of campaigns, director of communications, director of global health U, and a GROW trip director. And then you could also be a general staff member participating on one of the campaign teams. But I should probably explain a little bit about just the different positions on the exec board, because I would assume that most of you would want to take a leadership role in group. The campaign coordinator leads the chapter's fundraising efforts. The Global Health U coordinator educates staff and the community about broad issues in global health while connecting these issues to their health partner. The director of finances is kind of like a treasurer. They control the flow of money into and out of the chapter's bank account. The director of community building cultivates the GlobeMed community. They work within the Middlebury community and also within our group to foster good relations. The director of communication publicizes GlobeMed events in order to boost attendance, and the Grow Trip director actually organizes the trip to the partner. So why should you get involved? There's three reasons. Global health matters on a big scale. And I'm going to quote a guy named Cole Gotham who's the deputy executive director of UNICEF, because he says it better than I do. He says, first and foremost, global health matters on humanitarian and development grounds. The human misery and ill health should appeal to our sense of solidarity with fellow human beings in this global village. Second, global health matters on the ground of global health security. Unlike people, diseases do not need a passport or a visa to travel. Third, global health matters on economic grounds. Global health programs are not expenditure, they are an investment. There's also global health at Middlebury. Global health at Middlebury, thanks in a large part to the Middlebury Global Health Action Network, has really become a hot topic on campus. They arranged a really cool symposium last year. They brought Paul Farmer to campus. There's a lot of energy, and this is kind of funneling the energy into something tangible, into something we can really have an effect. There's also a lot of benefits to you, which are important. There's involvement in a meaningful and critical movement. You will learn a diverse set of perspectives and approaches to tackle global problems. You'll make an immediate, significant impact in people's lives, and you'll meet and network with hundreds of others in our network. We do have a couple of expectations. We're looking for devoted individuals who are willing to learn, willing to put the time in, and willing to make an impact. So therefore, attendance at all meetings is really necessary. But how to proceed, you can write your information on a sign-up sheet. A lot of you already have, and we'll be sending you interest forms tonight. Just have a couple of questions. Hannah has it's just going to show you what they look like. But they have a couple questions just to see like what your interests are. Not a big deal. Just put like half an hour time in and try and get them back by Friday at 10. Friday by midnight, and then you'll probably hear back from us by Saturday or something. Any questions?
When are the weekly meetings?
That's actually a good question. There was a lot of people who couldn't make the session tonight, so we're actually thinking maybe Sunday. And I don't know how that works for everybody. But that seems like it's the best time for, in terms of no class, no screenings, etc.
There is a place to write down your availability.
And that's why we're recording it. We're not recording if you're doing other homework or something. Any other questions?
Do you know when the Grow Trip would be?
The Grow Trip would actually probably be next summer. They tend to be pretty lengthy, so there'd be like a month long or a month and a half long trip with maybe like half a dozen people. All right. Well, thanks for coming. Hopefully, you can sign the sign-up sheet. Just indicate if you're interested in an executive board position. And thanks, guys, for coming. I really appreciate it.